Hi guys, how are you doing? I'm hoping you are doing well. Welcome to today's episode of learning, and today we are going to discuss about peptic ulcer disease. In the previous discussion, we talked about gastritis, and we said that if gastritis is not well managed, it will proceed to forming an ulcer in the stomach. And so today I want us to talk about peptic ulcer disease. Um, what is peptic ulcer disease? It is the formation of an ulcer in the upper GI tract. It is the formation of an ulcer in the upper GI tract. The upper GI tract consists of the mouth, esophagus, the stomach, and the first part of the small intestine called the duodenum. So, a peptic ulcer can form either in the stomach or in the duodenum. And an ulcer that forms in the stomach is called a gastric ulcer or a stomach ulcer. And the one that forms in the duodenum is called a duodenal ulcer. Duodenum ulcer. So, what are the causes of a peptic ulcer disease? We have two common causes. Number one, we have a bacteria called H. pylori. H. pylori is a bacteria that is known to cause 90% of all the peptic ulcer disease. It's called, its route of transmission is through fecal to oral. We discussed about that last time. This bacteria, once it's present in the system, it will be present in either blood or stool. So if an infected person passes stool either in water or maybe in a river, and people, or you fetch that water, drink it without maybe boiling it or treating it, that is how you are going to contact the H. pylori bacteria. So it will go through your mouth to the stomach, where it will cause an ulcer. Another cause is there's a class of medications called non-steroidal anti-inflammatory drugs. An example is brufen, aspirin, and diclofenac. These medications, if used for a long period of time, they irritate the stomach lining. Breaking it down and thus exposing the stomach to gastric acids. And the gastric acids, we have HCl, hydrochloric acid, which is used to break down food for easy digestion. And so if the stomach lining called the mucosa is broken down and the stomach gets into contact with these gastric acids and also pepsin. Pepsin is an enzyme that is used to break down proteins. If the stomach is exposed to these acids for a longer period of time, then they will expose the stomach to these acids, and then an ulcer will form. So what are the symptoms of peptic ulcer disease? What are the symptoms of a peptic ulcer disease? Number one, we have indigestion or a feeling of fullness in the stomach. Number two, we have epigastric pains. That is the pain that occurs along the epigastric region here, and it's usually burning in nature. Number three, we have vomiting blood. Number four, we have weight loss. Number five, we have heartburn. We also have melanostool or dark blood in stool. We also have loss of appetite. Those are the typical symptoms of a peptic ulcer disease. Number one, we have indigestion or a feeling of fullness in the stomach. Number two, we have epigastric pain that is burning in nature. That is pain that is usually along the epigastric region. We have vomiting blood. We have weight loss. We have blood in stool. We have loss of appetite, and we also have heartburn. Those are the clinical features or symptoms of a peptic ulcer disease. So, how is a diagnosis of a peptic ulcer made? Once you come to the hospital, you explain these symptoms to the doctor. How will he be able to know or to tell that you have a peptic ulcer disease? Number one, we have through history taking. These clinical features can make a clinical diagnosis through the symptoms. Once you say these symptoms, the doctor will first of all suspect that you might be having a peptic ulcer, and then he will go ahead and do some tests. Number one, he will do a stool test. A stool test is to confirm whether you have H. pylori, a bacteria. It will be seen in stool or in blood. Number two, we have an endoscopy. An endoscopy is an examination carried out. The doctor will use a tool called an endoscope. An endoscope has a torch, and it also has so the doctor will go into he will use an endoscope to visualize to your stomach, and he will be able to see if you have a peptic ulcer. Number four, we have a CT abdomen, and then we have a barium swallow. This is where you will be given a liquid that contains barium. You will swallow it, and then an X-ray will be done to detect any abnormalities in the stomach. So those are 5 ways in which the doctor can make a diagnosis: through history taking, an endoscopy, a stool test or a blood test. We have the CT abdomen, and we also have a barium swallow test. So once the diagnosis has been made that you have a peptic ulcer disease, what is the management? Number one, we have antacids, very commonly used out there. Antacids, they help exposure of the stomach, to reduce the exposure of the stomach to the gastric acids. We have antibiotics. If you have H. pylori, then you will be given antibiotics to clear the H. pylori from your system. We have a group of medications called proton pump inhibitors. These ones, they reduce the rate at which the gastric acids are produced. And in severe cases, your doctor will do a vagotomy. This is when the vagus nerve is cut to prevent stimulation of production of hydrochloric acid. We also have a gastric resection. This is when your surgeon will go and remove the affected part of the stomach. So that is the management. What are the complications of peptic ulcer disease? Number one, we have GI bleeding. That is why you will find out that these people, they vomit blood, or there's blood in their stool. That means there is a bleeding from the ulcer, and bleeding will lead to anemia. We also have peritonitis, and we also have increased risk of cancer. If your stomach is exposed to these gastric acids for a longer period of time, you might end up getting a stomach cancer. So what is the prevention? How can we prevent getting a peptic ulcer disease? Number one, we said the causes is H. pylori bacteria, and we say that the mode of transmission is through the fecal to oral. So to avoid getting this bacteria, you have to practice hygiene. Mostly just treat your drinking water or boil it to ensure that all the bacteria is killed. And also practice hand hygiene. After visiting the toilet, make sure you wash your hands. After changing the babies, make sure you wash your hands. Before eating, make sure you wash your hands. Wash your fruits before eating. And also cook foods well so that you can prevent getting the bacteria, because it's transmitted through the feces to oral. So someone who is infected can pass feces anywhere, in water, river water. For those people who fetch water from the rivers, make sure you boil or treat water before taking it. And also tap waters. You don't know, maybe there's a breakage in the pipes that are used to pass this water. So just make sure you treat tap water before taking. And also, if you are eating raw fruits, make sure you wash them with clean water. And also cook foods well. Another cause we said is this classification of medications called non-steroidal anti-inflammatories, brufen, diclofenac, and aspirin. These are the most common used. They are used to for fever management and pain or inflammation. You can use them, but do not use them for a long period of time, because they break the mucosal lining of the stomach, thus exposing the stomach to the acids. And also, if you have gastritis, avoid using these medications, because already your stomach mucosa is broken down. So if you continue using, that means you are increasing a risk of getting a peptic ulcer disease. And also under nutrition, you will see your nutritionist and he will advise you on the kind of foods you need to take, because you need to avoid all acidic foods. Including sukuma wiki, including fruits like oranges. That one you will have to visit your nutritionist so that he will help you to know what kind of fruits and what kind of foods you need to take. So that is the brief discussion about peptic ulcer disease. I hope you have learned something, and thank you for coming back. Please subscribe to this channel so that we may continue learning. Thank you for tuning in.